Hi, this is Bryson Leppa. I'm the Vice President of Clinical Services for Rebound. Today we have the honor and privilege of talking with Dr. David Brown. Dr. Brown is an orthopedic surgeon and sports medicine trained fellow of OrthoSouth in Memphis, Tennessee. Dr. Brown's been with our program for approximately 3 years now and has been a huge advocate for what we're doing. So we're happy to have the honor for him to take time out of his busy clinic schedule to speak to us today about his work with us and the advantages of working with a program like Rebound.
So I'm David Brown. I live in Memphis, Tennessee. I work at OrthoSouth, which is a large subspecialized orthopedic group, and I mainly do shoulders and knees. I specialize in sports medicine.
What kind of drew you to wanting to be part of this? Because I know you kind of reached out and were really excited about once we kind of got this up and running. Was there something specific that kind of spoke to you as far as your practice, or is there a reason kind of why this made sense for what we were doing and why it was a fit for you?
Yeah, I think two things. I think one is that the firefighters are a unique breed of individuals. They are very motivated to get back to work, and they're just fun to work with. They're just very enjoyable patients. And in general, they do really, really well, especially after big injuries. Number two is that it's a great way to help our firefighters. It's a good way for me to be able to give back and hopefully be able to provide some more efficient care than what they're used to.
One of the goals of our program is quick diagnosis. Obviously, that helps the department, it helps the firefighter, but why does that help you as a provider to have someone that's had an orthopedic injury get to you faster than saying it's taking them 2 or 3 weeks down the road to get to see you?
I mean, the obvious reasons of just, you get to injuries sooner, and the quicker you can fix these injuries, the better off, patients usually do. But then you just have the element of, before Rebound, it would be 3, 4, 6 weeks before somebody would come and see me, and they just hadn't made any progress and they're not happy. And so it's just not good when patients show up and they're already not happy.
Yes. Yes, absolutely.
So it really is. It's been a great program.
It's hard to get off on a good foot when someone shows up already mad, huh? Is there a type of injury you're kind of seeing more frequently than others with them? What type, is there a certain diagnosis seems to be more frequent with this population, or is it kind of all over the place?
So I think, we are subspecialized at our group, and so we try to, divvy out those patients accordingly. So
Sure.
If someone has a bad finger injury, we're going to get them to the hand doctor. And so I'm primarily seeing, knees and shoulders with a little bit of everything else. And so, I see a variety of injuries, but probably the most common is going to be, the knee. It's a very vulnerable joint, especially when you're, getting in and out of precarious positions.
Okay. And I guess maybe the better question in that is there something maybe you've learned from working with firefighters more a little bit through our program about their work, about how they get injured, something maybe more specific to the department and their occupation that maybe you hadn't thought of before, or is it kind of just general trauma, orthopedic injuries that kind of sustained by everybody?
Yeah, I think the biggest thing that I've learned is just, I treat these patients much more like the sports medicine injuries. If an athlete comes to see me, just the process moves so much faster. We're going to get an MRI faster if I think it's necessary, because we're trying to, just like you're trying to get an athlete back into sports, you're trying to get the firefighter back into work a little quicker. And so,
Sure.
You're going to do less, it's not that you're going to do less conservative management. It's just that, the ball just gets rolling a whole lot faster with these injuries. And I like that.
Do you see challenges with dealing with an injury that's maybe an on-duty injury versus an off-duty injury? Do you treat them differently, or maybe how does that process in your mind whenever a firefighter comes in with a softball injury as a reverse to a falling through a roof injury? Does anything change in your practice really for that?
Not really. I think that I don't think I treat the work comp or the outside of work injuries differently, just because the goal is to get them back to work fast. And that doesn't really change either way. I think that the firefighters are somewhat unique because they do not like light duty. And so, because that makes them work, at least in Memphis, they have to work 5 days a week, whereas they like their schedule, and many of them have second jobs.
Yes. Right.
And so that just speeds things up because they
Yes.
just want to skip straight to full duty. They don't want to go back to light duty.
Yes, absolutely. They do not like pushing paper. They'd rather be on the truck doing something.
Just seeing something, a simple ankle sprain that say a firefighter got injured at work, and you see him for a sprain, and you get to know him, you see him for a few visits, and they get back to work, and then 2 months later, their son comes in, after he got injured playing baseball. And so it just creates a network for these people. They know where to go. They build a relationship with someone so that, it not only helps them, but it helps their family.
Yes.
I think it's a really big benefit of the program.
Dr. Brown's been great because he's helped, other than just his own piece of it, he's helped with physical therapy that they have within their own group. He's helped push through MRIs when we've needed. And again, they have it within their own group at times. So, I think Dr. Brown's a great example of what this is supposed to look like and hopefully ideally looks like. But also, I feel like we're hopefully not putting more work on Dr. Brown with these things. It's also a good thing for his practice and what he wants to see on a day in, day out basis of making it a meaningful work day.
It's a great program. It really is.
Thank you.
Great. Thanks, y'all. We'll see you.